Hello and welcome back, and today's video is on upper lid blepharoplasty or upper eyelid surgery. So friends, today again we will be discussing another case of this young beautiful lady who came to us with a lot of extra skin in her upper lid. Due to her age related issues, there was a lot of extra skin that had developed over the period of years, which was causing a lot of discomfort in her upper lids. She contacted us for upper lid blepharoplasty, and we did a plain simple upper lid blepharoplasty, and you can see how much of a change it can bring to your face. This is her before after results, and today we will be discussing this case in detail. Hello friends, my name is Dr. Ankit Gupta. I am a plastic surgeon and I practice in New Delhi, Pitampura at Panache Aesthetics. Guys, I do a lot of eyelid surgeries, that is blepharoplasty. We do a lot of upper lid and lower lid blepharoplasty, and today we'll be talking about upper lid blepharoplasty. So guys, in upper lid blepharoplasty, what all can we do? We can take out the extra amount of skin, like in this case. We can also take out a little bit of fat which is excessive or protruding. Sometimes there's a lot of extra fat in the inner portion of the eye that we can reduce. In younger patients, sometimes there is a lot of puffiness in the upper lid that can also be tackled with upper lid blepharoplasty. And sometimes those who do not have a good crease, like in our Asian population or those who are from the northeastern part of our country, we can create a new crease through the upper lid blepharoplasty. We can also tuck your eyebrows up and do a Bropexy through the upper lid blepharoplasty, which can improve the shape of your eyebrow. Though it cannot lift it to a lot of height, for that we need to do something from above, but still we can always lift your brows by a centimeter or so using this same upper lid blepharoplasty incision. So friends, coming to today's case, this lady, she had a lot of extra skin. As you see, there's a lot of extra skin that had developed in her upper lid. Because of this loose skin, it was now hanging and the lid crease was not really visible. It really hampers a lot in females who like to put on makeups in their upper lids because the crease is not visible. So the areas where they put mascara is not really visible. So what we did was a very simple surgery. All we need to do is mark the area where the crease is, mark the extra amount of skin and just trim that extra amount of skin. Such a simple surgery would give such a wonderful result. All you need to do is remove the skin, stitch it properly so that the scar lies exactly in the crease so that it is not visible. To tackle the extra skin on the sides, we have taken out a little bit of skin from the sides, and that is why you can see a little bit of scar coming out of the crease, and that we try to keep it in the crow's feet or the lines which are there across the eyes. What it does is it will take care of the extra skin that is on the sides as well. If she had combined something like a Bropexy with it, it would have given even better results, but after discussion she did not want to change the position of her eyebrows. We can always add this Bropexy if somebody needs it. So this is all about upper lid blepharoplasty. Very simple surgery which is done under local anesthetic. It takes hardly about half an hour to 1 hour to do, and it is almost painless. Yeah, you get 3 pricks, 3 injections on each upper eyelid. It does not affect your vision. We are not dealing with your eyeballs. We are only dealing with the eyelids. So all we are doing is cutting the extra skin or trimming the extra fat if it is there. It will not affect your eye vision, and it will not leave a very ugly or a very prominent scar. After about a month or so, it is hardly noticeable. The scar, if you see in long term, after say 6 months, it is hardly visible. These results are very early. It is only 7 days after the surgery, and still you can see the amount of change. She still has a lot of swelling. It will take about a month or so for the swelling to subside, but you are socially acceptable after about a month. So guys, if in case you have a lot of extra skin in the upper lid, or if you have a lot of extra fat in the upper lid, this is a very good surgery that you can opt for. It's called as upper lid blepharoplasty or upper eyelid surgery, and you can always opt for that. Make sure that you don't have brotosis, that is your brows are not sagging. If that is the case, the ideal treatment is to get your brows fixed along with your upper lid blepharoplasty, because only after fixing your upper brows you will get a very good result of your upper lid blepharoplasty. That is all from my side. If you are interested in knowing the types of Bropexys or the type of brow lifts and the other stuffs related periorbital surgeries, you can always follow our channel. We regularly update or regularly post videos on periorbital rejuvenation, blepharoplasties, broplasty and facial rejuvenation. You can always follow us. Thank you and have a nice day.